This is a case of a 40-year-old female who consulted for a gradually enlarging anterior neck mass. She noted that the mass has been present for about 2 years. She says she is not really feeling any other signs and symptoms, such as palpitations, difficulty of breathing, increased heart rate, nor weight loss. On examination, the mass was located at the right side of the neck. It was noted to be firm, movable, non-painful, and moves when asked to swallow. To come up with a diagnosis, one of the tools needed is a good history and physical exam of the patient. We will show you how to properly perform the physical exam of the thyroid gland. First, properly introduce yourself to the patient. Allow her to introduce herself and get the patient's information. Explain the procedure to the patient and gain her consent. Before starting the examination, do not forget to properly wash your hands. With the patient seated, inspect the anterior lower half of the neck. Tilt the patient's neck backward and ask her to place her clasped hands on the occiput for support. Instruct her to swallow in this position. The thyroid cartilage, the cricoid cartilage, and the thyroid gland all normally rise as the person swallows. Palpation is probably best done from behind the patient. Ask the patient to relax. Place the fingers of both hands on the patient's neck so that the index fingers are just below the cricoid cartilage. Feel the thyroid isthmus rise under your fingers as the patient swallows. Rotate your fingers slightly downward and laterally. Feel as much of the lateral lobes as possible, including their lower borders. Auscultation should be done if the thyroid gland is probably enlarged. With the bell of the stethoscope, listen for bruit while the patient holds her breath.